Hello and welcome to the S&P Senior Medicare Patrol podcast, Sip and Learn with S&P. Thank you for joining us today. I am Johnetta with Senior Medicare Patrol. I am the Community Outreach Specialist for the Mississippi area. We also cover the state of Georgia. So today, the topic for today is understanding your Medicare Summary Notice and explanation of benefits. We are going to just dive a little deeper into this topic and of course, give you a little bit of information about the S&P program.
Hello, and I am Brenda. I am the Community Outreach Specialist for the Louisiana area. Before we get started today, I'd like to say that this project is supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services, Washington, D.C., 20201. Senior Medicare Patrol, or S&P, is sponsored by AdviseWell. So today, as Janetta said, we are going to be talking about understanding your Medicare Summary Notices, or MSNs, and explanation of benefits, EOBs. Janetta, what is the Medicare Summary Notice or explanation of benefits? Can you tell us?
Sure. So the Medicare Summary Notice is also known as the MSN. And the MSN is a notice or a statement that people with original Medicare receive in the mail every 3 months. And they receive this for their Medicare Part A and Part B covered services. Okay. If you don't receive any services or medical supplies during the 3-month period, you won't receive an MSN for that 3-month period. The explanation of benefits is also known as the EOB. And the EOB is a notice that people with the Medicare Advantage Plan, Part C or Part D prescription drug plan receive. And they get this notice after they receive medical services or supplies from their prospective plans. EOB is usually mailed every month, but this does depend on the Medicare Advantage provider. All EOBs show the same information, but the layout and other specifics may vary by the plan. Like the Medicare Summary Notice, the explanation of benefits is not a bill, but it is your record of what services or products Medicare has paid for on your behalf. So it's very important to review them and make sure the information is correct. Okay.
So when you get these in the mail, you should not throw them away, correct? You should look at them?
Absolutely. When you receive these in the mail, it does say that this is not a bill. So we want you to make sure you're not throwing these things away, keeping them for your records, just in case you have to refer back to them.
Okay.
Okay. So Brenda, tell us, when looking at the MSN, what is it showing? And explain to us what is on the page.
Sure. I know that a lot of people may get overwhelmed when they see these in the mail, and that's probably why they throw them away. They don't want to look at them. But as you said, it's very important that they open them and look at them. And the Medicare Part A MSN shows all the services billed to Medicare for inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care services. The Medicare Part B MSN shows all the services billed by Medicare for doctor services, hospital outpatient care, preventive care, and other medical services, like your laboratory services. On the first page of the MSN, you will see your deductible status, claims, and costs for that period, and the total you may be billed and the providers with claims this period. The second page of the MSN provides you with information on how to check your notice, how to report fraud, and where to call to get help if you have questions. And the next few pages after that of the notice will provide detailed information on all your claims. The claim information shows the date of service, the number of the provider, their address, and phone number. It also provides a detailed description of the services or equipment that you have received. The last page of the MSN provides detailed information on how to handle denied claims and how to file an appeal. For assistance in filing an appeal, you can contact SHIP, which is the Senior Health Insurance Information Program. Those numbers are available here with us. In Louisiana, the SHIP program is 1-800-259-5300. If you live in Mississippi, the SHIP phone number is 800-948-3090. And if you happen to live in Georgia, it's Georgia Cares SHIP at 866-552-4464, and you press option 4. So it's very important that you review your Medicare summary notices for any mistakes or errors or just things that you may not understand. If you have any questions, you need to call and ask those questions. And another tip that we have is to keep track of all your medical visits or laboratory visits or anything that has to do with your healthcare. You can get one of these My Healthcare trackers from us, free, just for listening or watching our podcast today. It has our Protect, Detect, Report message inside the booklet, but also a nice little area here where you can write all the information about the doctor you are visiting, when you're visiting that doctor, what services were provided to you on that day. And so when you do get your MSNs or EOBs, you can compare them to your healthcare tracker information. And that way it'll help you keep up with what is going on with your healthcare. You can get one of these free today by calling 1-877-272-8720. Okay.
Yeah. Again, that number is 877-272-8720 for that free healthcare tracker.
Correct.
Yeah.
So, Janetta, how do you detect fraud or errors on your MSNs or EOBs? What should you look for?
Okay, when reviewing your Medicare Summary Notice or the explanation of benefits, it's helpful to use a personal healthcare journal or a pocket calendar to keep track of medical services or equipment that you have received. You can use your journal or calendar to compare it to your MSN or EOB and make sure everything is correct. And that is how you're going to detect the errors. You want to make sure you have a copy of the services that were provided. Having that tracker is a great way, making sure you can, because you can't remember lots of things sometimes. So you can write it down, jot it down, and then you can compare it to your Medicare Summary Notice. The Healthcare Journal is the booklet that allows you to keep track of every aspect of your medical information. It includes that section that Brenda was speaking about, that you can list your doctors and doctors' names and appointments. You can record the dates of the appointment, the name of your doctor, and also the reason for your visit. You can use this information to compare it to the claim listed on the MSN or the EOB.
And that's exactly what we had talked about in the question previous to this one. It's your healthcare tracker that's going to help you watch over what's going on with your services when you get your MSNs and EOBs. You can compare them and you don't have to think really hard about what happened on such a certain date because you'll have it all here in your healthcare
journal.
tracker.
Yeah.
And it's free. Who doesn't like free items? Call 1-877-272-8720 and we'll gladly put one in the mail for you or for whoever's watching with you. So just let us know how many people are watching and we'll send enough trackers for you. Okay. All right.
Good deal.
Good deal.
Okay. So Brenda, tell us, when viewing the MSN, what should we focus on?
Yes, when reviewing your MSN, focus on the claim details section. These are the things you want to focus on. Number one, the date of service. Did you have an appointment on that date? Are you sure? Make sure the dates match. Number 2, provider's information. Do you recognize the names of each doctor or provider listed on there? Just make sure that they are the correct people that you visited that day. Number 3, services provided. Did you get all those services listed on there? Did you get those services that day? Did you get the number of services that are indicated on there? You need to make sure that all of that matches. And number 4, maximum that you may be billed. Did the provider charge you more than the amount listed? If you have any questions about any of these things, you can contact us at Senior Medicare Patrol at 877-272-8720, Monday through Friday from 8:30 to 5 p.m. Central Time, or you can contact us directly on our website at www.stopmedicarefraud.org. We are here to help you with, it's a free resource to you. SMP is a free resource to any Medicare beneficiary who may be having questions about anything to do with their healthcare fraud, especially with Medicare. So call us, we are here for you. And if everything is correct on your MSN, then you can go ahead and shred it or store it in a safe place for your records. It's very important, as we said in the beginning, that you open these summary notices and check them, review them, make sure everything's correct, because that is how you're going to know if your Medicare number was compromised or not.
Absolutely.
Okay?
Great information. Yes.
Okay. So, Janetta, what should you do if you notice something strange or suspicious on any of these MSNs or EOBs that you get? What do you do?
Okay. If there is an unusual or suspicious claim on your MSN or your EOB, you must report it. You should start by contacting the provider and asking questions about the claim. If you are not satisfied with the response that you get from the provider, or if you are uncomfortable calling the provider, you can call Senior Medicare Patrol for help. Our number again is 877-272-8720. Call Monday through Friday, 8:30 to 5 Central Time. Or you can contact us on our website at www.stopmedicarefraud.org. And now that you know what to look for on that MSN and the EOB to detect possible fraud or errors, we want to remind you of our 3 main Medicare fraud tips. These are our Medicare fraud prevention tips. The first tip is protect. Treat your Medicare card and the Social Security card like a debit or a credit card. Do not carry it with you unless you need it. Do not provide your Medicare number to individuals that are not authorized medical professionals. Do not give out that information to people that you do not know. The next one is detect. Keep track of your visits to doctors, clinics, hospitals, or pharmacy, and compare them to your MSN or EOB. Review your information for potential errors, fraud, or abuse. This includes double billing, billing for charges or services not received, and for services not ordered by your doctor. And the next one is report. Report if you suspect that you are at risk or may be a victim of Medicare fraud. Report it immediately. Don't wait. Contact your SMP for assistance. Reporting any possible errors or fraud helps to save you money and prevents others from becoming a victim. Okay, Brenda, so tell us about our volunteer program or about volunteers.
Yes, Janetta, that's a very important part of our program. The volunteer program, or as we'd like to call them, our community fraud fighters. If you think you'd be interested in becoming one of our volunteers / community fraud fighters, you can call 1-877-272-8720 for more information. Now, a lot of people ask us, what do volunteers do exactly with your program? Well, if you enjoy talking to people, going out into your community and networking with your neighbors or your friends, if you enjoy standing up for yourself and for your rights and for your medical rights, this program is perfect for you. We ask you to just share our message of protect, detect, report. Talk about how you can protect yourself from the scams that are going on. We ask that you share that with the people at your presentations. We give you the materials to give out and share with them. It's just something that everyone that likes to network and talk to people, it's a program I think that you would really, really enjoy. And it's perfect for retired teachers, retired law enforcement, people that maybe worked in the medical field, because everything has to do with community and healthcare. So again, if you think you'd like to become a community fraud fighter with us, 1-877-272-8720 is the number you need to call for more information. And I'd also like to say that the Senior Medicare program, or rather the Senior Medicare Patrol program, is in all 50 states. Today, we've focused on Louisiana, Georgia, and Mississippi, but actually this program is in every single state and US territory. So if you're listening from somewhere else, maybe perhaps you're living in Tennessee or in Maine or in Hawaii, you can call the S&P resource at 877-808-2468 to get your local S&P phone number and be connected to them. We all do the same thing. We are all here as a free resource to you, the Medicare beneficiary.
Wow. Yeah. Getting involved in the community and just participating is always a good thing. It keeps you busy.
It is. It is. And we're doing something good, trying to keep all that money in the Medicare program for the right reasons.
Absolutely. Okay.
Yes.
Well, that was an overview of our podcast today, Understanding Your MSN and EOB. We hope you enjoyed it. Thank you so much for tuning into this episode.
Yes, thank you for joining us here at Sip and Learn with SMP. We hope you join us again for our next podcast coming really soon. We have a lot of important information, SMP content on different topics that we know you will enjoy. Thank you for joining us today.
Thank you. Bye-bye. Until next time. Bye, Brenda.
Bye, Janetta.